So, in the name of Almighty Allah, I am Tauseef Iqbal. I welcome you all in my YouTube channel. So, basically, we have started a series of lectures on important medical terminologies which are commonly used inside clinics and hospitals. So, in previous lecture, we have already uploaded uh, a few lectures about important medical terminologies. So first one is cystitis. So if there is inflammation of urinary bladder, so we call it cystitis. So this is basically inflammation inside urinary bladder. So if there is inflammation of urinary bladder, so we call it cystitis, and this is basically simplest and shortest definitions. Next is cervicitis. So if there is inflammation of cervix, basically cervix is a reproductive part of human female reproductive system. So if there is inflammation due to any reason, so that condition is called cervicitis. This is uterus, this is fallopian tube, this is oviduct, and this is cervix, and last part is birth canal. So if there is inflammation inside cervix, that is called cervicitis. Next is enteritis. If there is inflammation of colon, so colon is basically part of gut gastrointestinal tract. So if there is inflammation due to any reason, so that condition is called enteritis. So intestine basically consists of two parts. One is small intestine and other is large intestine. So small intestine consists of duodenum, jejunum and ileum, while large intestine consists of cecum, colon and rectum. So colon is the part of large intestine. Next one is nephrolithiasis. If there is stone inside the kidney, if there is stone inside ureter, or specifically inside kidneys, or it may be in one or both kidney. So if there is stone inside kidneys, so that condition is called nephrolithiasis. So this is ureter, this is kidney stones, different sizes stones, this is calyx, and this is renal pelvis, this is outer part, and that is renal cortex, while inner side is called the renal medulla. So stone inside the kidney is nephrolithiasis. Next one is diplopia. So if someone having eyes problem, so if they are seeing single entity as a double, so diplopia is basically double vision. So normally human hand consists of 5 fingers. If they are looking more than finger, or they looking tends to human eye, so that condition is called diplopia. Diplopia simply means double vision. Next is hydrophobia. So hydro mean water and phobias mean inappropriate fear. So basically hydrophobia is fear of water. So if someone is bite by rabies, or person having infection of rabies, so one of the symptom of rabies is hydrophobia. Normally child are more resistant to water and they feel fear from water. So if there is pathological state and person or individual feel fear from water, so that is a hydrophobia. Next is hemiplegia. So hemi mean half. So paralysis of one side of the body. If there is paralysis of one side of the body, so that is called hemiplegia. If there is so there is basically different types of cerebral palsy. So if one hand is affected or one arm is affected, so that is monoplegia. If half of the body is affected, that is hemiplegia. And this is basically diplegia, and this is quadriplegia. If both hands, both arm and both limbs or feet are affected, so that is quadriplegia. So in that, in mono means single or one, so that affect one limb, usually an arm, while hemiplegia basically affect one side of the body including arm and legs. And diplegia affect symmetrical parts of the body include legs and arms, while quadriplegia affects all four limbs, upper limbs and lower limbs. Next one is neuroplasty. So neuro is derived from nervous system, while plasty is from a surgery or plastic surgery or simply surgery. So surgical repair of nerves. So basically in neuroplasty is a minimally invasive procedure that loosens and free nerves, scars and adhesions. So if there is problem in our different nerves, so we perform a surgery, and that is neuroplasty. And that if there is a problem inside nerves, so if nerves become combined and cohesive with each other, so in that technique nerves become free from each other and they become loosened. So surgical repair of nerves is called neuroplasty. Next one is thrombosis. So formation of blood clot. So basically this is blood clot inside vein. So thrombosis can occur mostly in veins. It may also happen in arteries, but specifically inside veins or in major veins. So this is collection of blood cells, and they have blocked the main artery or vein. So this is thrombosis. Next one is nephroptosis. So downward displacement of the kidney. So this is a healthy kidneys, while this in this condition this is nephroptosis. So if we look to this, there is displacement, there is the downward moment on one side of a kidney. So this is basically a healthy kidneys, while due to some pathological or other disease condition there is a downward moment of a kidney. So that is nephroptosis. Next is arrhythmias. So arrhythmia is deviation of normal rhythm of heart. So this is basically a pattern or normal rhythm of a healthy heart or normal heartbeat, while if there is problem or there is deviation or there is a disease condition, or if there is disorder inside cardiac muscle or simply in heart, so there will be irregular heartbeat, and we call it arrhythmias. So thanks for watching. Please subscribe my channel. Hopefully in next days we will upload lecture on other important medical terminologies. So thank you, good wishes.